Our Southern news at this hour, the Limpopo Health Department has conceded that there was political influence in the awarding of PPE tenders. The MEC Doctor Phophi Ramathuba and her management team appeared before Parliament's Standing Committee on Public Accounts in Polokwane. So perhaps for this and more, we're going to be joined by Zoom by Karam Singh, Corruption Watch Executive Director. Karam, good afternoon. Thank you for your time with us here on the SABC.
Thank you for having me on the program.
So about 125 million rand meant for personal protective equipment, PPE in the province is in question. What do you make of the MEC now conceding that there was indeed political interference in the tender processes at large?
Well, I mean, whenever these things come out, there's always a bit of mixed emotions. On the one hand, it's positive that the disclosure's been made, that Scopa's effectively executing its mandate and this information is coming out. Obviously, underlying it is a very disappointing story and a lingering story of massive collusion and corruption in the acquisition of PPE. So, in this moment when the country was incredibly vulnerable in response to the COVID pandemic, which we, were responding to, that there were unscrupulous operators in collusion with officials in different provincial departments who sought to benefit from this, to benefit their own private pocket. And then this, then just speaks to the lingering challenges that we have around grand corruption. This idea that we out of the era of state capture, because we've had the Zondo Commission's report, is proving not to be true, because we've seen these massive corruption scandals now, since that era. So it's obviously very concerning, and hopefully law enforcement will get to the bottom of it and they'll be able to pursue accountability for this.
There was a search and seizure operation that happened at the offices of the Limpopo Health Department in Polokwane in July of 2022 by the Hawks and the SIU. And I just wonder at this point, if there is enough accountability in your view from those that were implicated in the SIU investigation, perhaps also looking at the investigations in the health sector at large, the level of impunity, is there enough recourse perhaps to serve as a deterrent and the monitoring of the sector at large? How would you weigh in on those questions?
I think when we talk about accountability, we talk about people being criminally charged and then prosecuted, and we haven't seen that. We've seen some officials been placed on suspension. We've seen some resignations through the SIU processes. We've seen some recoveries of assets. So those are all forms of accountability for sure. But the ultimate, criminal accountability, the prosecutions on the basis of corruption of public officials who colluded with service providers, we haven't seen that yet at all, and we haven't seen that also in response, to the state capture cases. So that the wheels of justice move very slowly when it comes to criminal prosecutions. And I think that's really where the criminal justice sector is found wanting, and where we have increasing frustration as the public in feeling that, people that are fingered, people that are implicated, people that are disciplined, are ultimately sanctioned by way of, beyond a reasonable doubt, criminal prosecutions.
What about these systems to perhaps detect and prevent corruption from the onset that are in place or not in place? How would you weigh in on how we're faring on that front as well?
I think this relates fundamentally to the issue of how public procurement functions across the country. We've seen, going back, 2 decades, that it's the capturing of the procurement divisions where the big looting happens, where significant maladministration, irregular processes, and ultimately the kind of corruption that we're talking about takes place. So, how do we get to a better public procurement system? One way we can do that is by having a more transparent system where there's greater obligations upon provincial departments to publish data so that it can be properly scrutinized. And now we do have a new public procurement bill before Parliament that highlights some of these issues and talks about putting new requirements around publication in place. And if you talk about preventing corruption, I think that's really one of the key areas we need to look at. I think we would say broadly, based upon our analysis of the draft public procurement bill, that it doesn't go far enough. But I think that's really where we need to move towards, is trying to future-proof the public procurement system in particular to it being so easily manipulated and hijacked by corrupt officials and service providers.
Karam, what do you think this impact or these revelations have on the health MEC in the province at large? And then perhaps as we look at the rollout of NHI as well, access to universal health care, I mean, there are some propositions, but there are also questions and concerns. How do you think this is the concerns relate to the NHI, given what's happened in Limpopo alone?
It remains to be seen what's going to happen with the MEC. I think this is an unfolding story. But if the MEC, if it comes out the MEC's implicated in this, then there are going to have to be consequences there. NHI is definitely an area of concern. It wasn't that long ago that we had a significant scandal around digital vibes involving former National Health Minister Zweli Mkhize, which was about effectively corrupt schemes in relationship to communication campaigns relating to NHI. So this is now, even before the NHI fund is set up, even before the money is pooled together, we already see opportunistic attempts to divert funds in an irregular and corrupt way. So I think this is, we have to keep the issues around anti-corruption, around preventative measures, around protection squarely on the agenda when it comes to the rollout of NHI. Otherwise, this could be another feeding scheme. This could be the next kind of national PPE type of scandal. So I think it's something that requires serious attention and vigilance, and it's certainly a vulnerability and a concern going forward.